Hey guys, welcome to another episode of the 4 Pillars of Health with Kevin Davis. Today we're going to talk about exercise and the metabolic effect when you exercise. Now, you want to stay to the end because I'm going to tell you what I did today. It's a Saturday when I'm recording this, and just kind of give you a typical day of what I would really like to do every day, even though I can't because I'm time limited. So if you don't know me, my name is Kevin Davis. I'm a physician assistant and online health coach, and I help people lose that stubborn belly fat, gain muscle, and optimize their health, not just so that they can get results now, but they can get results long term. Today we're going to talk about, guys, we are in a series talking about our metabolic health. Now, our metabolic health is basically this: it's how we use our energy and how we store our energy. And if you can signal your body the correct ways, then you're going to be able to use the energy when you need to use it and store it in the correct manner. And this is where exercise comes in to play, because if we want to store energy, the best place that we can store energy is in our muscles. And if we are exercising, if we're doing the things that we're supposed to do as far as, stimulating our muscles for growth, we're going to be able to store excess of energy in muscle and not in fat. That's why you can see a lot of guys and women exercise who can eat a whole lot and they don't seem to gain any fat, is because they have all this muscle. Now, if you're listening to this, you're probably in your 30s, 40s, 50s, somewhere through that time. And, your goal is not necessarily to be Arnold Schwarzenegger. Your goal is to be fit and trim and to be healthy. And that's where I'm at as well, because that's what I want. Obviously I want to have bigger muscles and have a 6-pack abs, and that's always a goal for me. But I know down deep, if I can increase my muscle mass, if I can increase my strength, then I'm going to be able to store that excess energy in the correct place. Now, what does that do? That's what we're going to talk about today, is why you should exercise. That's going to bring some of the things out. So if you look at exercise and you look at diet, okay, it's not a 1 + 1 = 2 relationship. It's a 1 + 1 + 3. It's synergistic. When you give your body what it needs as far as nutrition, and you move and you do the correct exercises, you do the different things to that, you're going to see a synergistic effect between those two things. And that's what we want to talk about. If you're still not convinced that exercise is important, the thing I want you to think about is if you're saving for retirement, if you're in your 30s, 40s, 50s, 60s, that comes across your mind sometimes. The last thing you want to do is to do whatever you want to do now, whether what age you're at. If you're not saving any money, wait till you be 62. You're going to retire at 65, let's say, and then try to hurry up and cram all your savings in that 3 years. That's not going to work. The best thing you're going to do is start back when you're 30s, and even if you're in your 40s now, or even in your 50s and you want to save a retirement at 65, what you do every day is going to be more important. So what we want to do is start early, start where you're at right at today. Don't wait till tomorrow. And then what you want to do is deposit every day. And I know with your savings, it's probably, you deposit monthly or whatever it may be. But with our health, what we want to do is deposit every day. We're not going to nail every day. We're not going to do exactly what we're supposed to do every single day. We're not going to exercise every day. But if you can make a small deposit, whether that be what we're going to talk about today with exercise, whether that be you're sleeping, whether that be you're nailing your nutrition, or you're taking time to put yourself in prayer to put you in a parasympathetic mode, which we'll talk about in future podcasts, then you're going to be able to start making those small deposits for your health later on. And that's when you're going to see more bang for your buck than you will be if you just start later on in life. So I just want to encourage you that there's a reason why we're doing this. And it's not just for bigger muscles. It's not so we can have 6-pack abs. Well, we know some of us want to have that, even though we don't want to admit it to other people. But what we want is to have optimal health. And that's what we're going to talk about today by incorporating exercise into our lifestyle. So why should you exercise? 4 reasons why we need exercise. 1, benefits. Obviously, we're going to be able to store more energy. If you're storing more energy in your muscles, it's not going to go to your fat. And you become more metabolically stable. You're not insulin resistant because your body's uptaking that glucose, that excess glucose, that's what we use for energy. It's going to uptake that, put it in muscles. It's not going to stick around in your blood. Therefore, your pancreas is not producing as much insulin. So if it's not producing as much insulin, you not become bulimia, meaning that you have high insulin levels, which is a precursor to insulin resistance, which is a precursor to metabolic syndrome, which is a precursor to diabetes. So you kind of see the timeline. If you have those things, you're going to be, or if you exercise and you have those muscles, there's a reason why we want to do that. The other reason for health is for your heart. If you're doing the right type of exercises, which we'll talk about here in a few minutes, then you're going to be able to be more heart healthy. Your heart's going to be stronger. It's a muscle. You got to exercise that muscle, and it actually can reset and help lower your blood pressure. So if you become metabolically healthy, instead of taking medications, you can actually change your lifestyle and maybe get off your medications. Obviously, weight management, not necessarily weight loss, but weight management. Actually, studies have been shown that, with resistance training, it does help with weight loss some, but it's not the major player. We have to talk about nutrition for that. But once you lose your weight, and again, we talk about energy balance for your metabolic syndrome. Once you lose your weight, you'll be able to store that energy much more efficiently. When you store it more efficiently, what's going to happen? Your weight's going to be able to keep that. So that's where a lot of people get in trouble with the yo-yo diet. They will go on a diet. They'll cut their calories in half. They'll lose some weight, but then they stabilize. What happens is it goes back to the where's your body going to store energy? When you're losing that weight, let's say, you lost 20 pounds. Well, it's not 20 pounds of fat, it's 10 pounds of fat and maybe 10 pounds of muscle. So if you gain that back, it's going to be all fat. And that's where yo-yo dieting comes. So you can kind of see if you need the muscle for energy storage and you don't have that and actually have less muscle, then it becomes harder the next time. So if you've ever been on that yo-yo dieting, you've cut calories, you lost 20 pounds, 2 years later, you try the same thing, you try to cut the calories, but you don't lose as much. Well, the problem is, you've already lost that muscle and you're just trying to lose that fat. So if you can get to the point where you do this correctly, and that's where I want to come in and help, is if you do this slowly, if you do it correctly, then you're going to be able to keep it off. So many people, you see things that want to lose weight 10 pounds in 2 weeks or something along those lines. Now, I've had clients do that just because they changed their diet, radically what it was before, and they went 180 degrees, in a different direction, and they lost that weight. More often than not, though, what we want to shoot for, especially as time goes on, is to lose about 1% of your body weight. So if you weigh, 200 pounds, that's 2 pounds a week is what we want to do. If you're able to maintain a lifestyle losing that 1% of your body weight, you're going to be able to keep it off. The other thing exercise helps with is bone health as far as medically. If you think about anything that increases your muscle mass, increases muscle, also helps bones. So if you exercise, do weight-bearing training, those type of things, you're going to increase your bone. Joint health. So many times people think, well, I can't exercise because I got joint pain. Well, you have to figure out what the problem is with joint pain. You could have arthritis. It could be something that we have to work around, see what kind of exercises you can do. But there's a lot of times what happens is you have muscles that are not as strong as they should. They don't support the joints. If we strengthen the muscles, the joints can get better. The second thing, as far as benefits from exercise, is emotional and mental well-being. So when you are exercising, there's certain things that are released from from your muscles, and there's certain chemicals like endorphins that are released as well too. You actually feel better. You've probably maybe you've heard of like runner's high. That's when endorphins are released and they feel so much better. People can sleep better, which can lead to better moods. It can be a benefit for your mental health. We've talked about nutrition. Studies have shown sometimes changing your diet can be as effective or more effective than taking medications for like depression or for anxiety. So if we start looking back to the root cause of issues, if we look back to what's causing things, then maybe we can reverse those, with your lifestyle, the things we talk about here on this podcast. The third thing that exercise does is it helps with your metabolism. We've talked about this before. When you increase your muscle mass, increase your muscle strength, what's going to happen is your body's going to be able to store more energy in those muscles, and actually your metabolism can actually increase. So the more that you develop as far as muscles from the exercise, then the more it's going to help you with your metabolism. Now, the other thing you have to think about, and the thing we talked about last week, was your nutrition. If you're not giving yourself enough protein to build that muscle, it's going to be really hard to build muscle. You have to give yourself enough protein to do that. And number 4 is just overall well-being with longevity, quality of life. If you're exercising exercising, you're able to do a lot of things that maybe you couldn't do if you weren't exercising. Carrying a bag in the airport, lifting up a bag and putting it overhead in an airplane, eating groceries, going up and down stairs. I've noticed this before in restaurants. I do this stuff all the time. I noticed some people going up and down stairs, and they're put their hand on the handle and they're taking one step at a time, versus somebody who's in their 20s doesn't even bother putting their hand on the rail, and they go down the steps much more quickly. Now, I'm not saying a 60-year-old should go down steps just like a 20-year-old, but wouldn't it be nice to be able to have that confidence to go up and down stairs without the thinking of, am I going to fall? Can I make these steps? That sort of thing. I've actually had a client, Clark. He visited some pyramids, and he was so impressed after being with me for, I don't know how long he was with me, several months at that time, is he was able to walk all the way up the steps to these, what you call, it's not a pyramid, but it's the things that's like in Mexico, in Tulum, where you walk up the steps, and that's just where Indians used to build these temples. But anyway, there was like multiple steps, like 100 steps or something like that. He could go all the way up the steps and not stop, versus some people who are half his age couldn't do that. So that's just emotional well-being. That's confidence in you start seeing things that you could. Now, so maybe you're convinced now that, exercise is important. It's going to help, medically. It's going to help emotionally. It's going to help with longevity. It's going to help with my metabolism. What do I do? And that's where I come in as far as a health coach, because this is where it gets a little bit individualized. But what I'm going to talk about right now is just some basic stuff that you need to incorporate in your not every day, but in your monthly kind of routines to make sure you're hitting all these areas. The first thing is aerobic exercise. That's where you're doing something like a long-standing exercise. That could be going for a walk, a hike, a row, a bicycle. Not necessarily going all out for the whole time, but you're getting your heart rate up. Maybe doing it for like 30 minutes, but you're not really going all out with this. The second type of exercise, and I think this is most important, is strength training. And this is where a lot of people kind of like shy away from. One reason I think that people shy away from, and I understand because I used to be there, is I never was in a gym. I didn't know what to lift. I didn't know how to lift. Am I going to hurt myself? A lot of people don't want to do squats. They don't want to do deadlifts because they're afraid to hurt their back. Well, you have to be careful with that, of course. But if you don't start doing some resistance training where you're doing some strength training, lifting some heavy things, then, you're not going to get the maximal benefits. Now, do you have to go to a gym? Do you have to do those things? No. You can do things at home. You can do things with a dumbbell. You can get one pair of dumbbells, 15, 25 pounds, depending on where you're at. You can get a lot of workout for that, and then once you get your confidence, then I think you're going to move up to maybe moving up to a gym or buying more equipment. The other thing that you can do with resistance training, and I've made some videos for my clients before for this, is resistance band training. You can get a great workout in 15 minutes. I've had people do the workout and they couldn't do the whole 15 minutes because it was so hard to do. So you can do some things like that. And then lastly, with the resistance training, you can do body weight, doing push-ups, different types of squats, different types of push-ups you can do. You can do chair dips. There's all kinds of things you can do with your body to get that resistance training. It's just sometimes you have to know what. And the third thing, as far as type of exercises, is called HIIT training, HIIT, high intensity interval training. Now, usually this is really hard to do. It's usually something like you do 20 seconds of exercise, 10 seconds of rest, or do 40 seconds of exercise, 20 seconds of rest. It's kind of interval training. And you want to do it just for a small amount of time. And I mean like one exercise or combine two exercises, so maybe 5 minutes or so. And do that a couple different times or a couple different exercises. That's important as far as like getting that burst of energy to maximize it. And a lot of times, even with high intensity interval training, you can do sprinting. Now, one thing that the studies have shown is with sprinting, it really helps with decreasing visceral fat. That's the fat that you have in your abdomen, and it helps decrease that. So that's an awesome way to help conquer that. Now, frequency and duration of training. The first thing with the aerobic is just consistency. Doing it once a week. That would be great. Once every 2 weeks, doing a 30-minute hike, doing a 30-minute walk, those type of. So many times I see people, that's all they do is 30-minute walks. And you look at them and they look at themselves, and in 2 months, nothing's changed. They didn't lose any weight. Maybe they lost a couple pounds, but they're not getting the results they want to get. It's because they're doing it the wrong way. With strength training, I recommend doing at least 3, sometimes 5, depending on where you're at, of episodes per week of training. Obviously, you don't have to stay in the gym for, hours at a time. You can do a good strength training exercise routine in 20, 30 minutes. And you can do it at home, the things that we talked about just a minute ago. And then hit probably once a week, twice a week at the most. You don't really want to be able to do that so much because it can overstress your body. And if you guys noticed, I didn't include like marathon type training where you're running miles at a time, because I think that increases your cortisol and and contributes to belly fat. So those are the things I don't really encourage a whole lot of people to do. Some people that I have as clients love to do those. I've had one guy who loved to run. I've got him now running maybe once a week, but doing mostly resistance training. And now he's starting to see results. So he's kind of started believing this is what he needs to do. So I told you at the beginning of my day today. And before I do that, I just want you to know that if you guys have any questions about the exercise, if you don't know what to do, contact me. We can have a conversation. I can maybe point you in the right direction. If you want to become a client, we can talk about that as well too. You can email me at Kevin David or any of my social media. Just send me a DM and I'll be able to get back with you. But today, I just want to talk to you about what I did today. It's Saturday. I got up, did some work on my computer, read my Bible, those things I do every morning. Did some stuff, for Renee around the house. And then what I did is with my heart rate monitor on, which I always try to wear when I'm exercising, I did an hour of different types of exercises in my weight room. I did some barbell snatches with a shoulder press. I did some ab workout. I did some legs workout. I did some biceps and tricep workout. I did a 8-minute video to show people kind of like what I do as far as body weight exercises. And that was a great workout. And then what I did after that is me and Danae, we went down to the track, which is the bottom of our hill, and we did some walking, running. The reason we did that is she's training for a 10-mile run in April at Walt Disney World. She's doing that with some of her friends. And one of the things that really helps her is having that accountability. They text each other how much they run, what time, those type of things. So they're kind of like training for this 10-mile run at Disney World. So that's an awesome 2 points I want to make out of that is if you're training for something, then it's easier to go do the things you need to do because you have a goal in mind. That goal could be like what she's doing is a 10-mile run. For you, and sometimes for me, it's lifting heavier weights. So I know to lift heavier weights, for me personally, I have to sleep well. I have to get my diet right. When I don't do those things, I notice in the weight room, I'm not lifting as much. So if I want to get increase in my strength, I have to incorporate this lifestyle into what I do on a regular basis to get to that goal. The other thing is having someone to do this with. If you are somebody who finds it hard to do the things by themselves, to motivate themselves when they're by themselves, having somebody or having a group is very, very beneficial. With her, it's her group of friends who are doing this race together. For me, I work out by myself most of the time because it's at 6 a.m. I do it in the gym by myself. But what I want to encourage you is if you find yourself struggling with this, if you find yourself, lacking the quote motivation and the discipline to do it, if you have somebody like me as a coach, you're gonna be able to have somebody in your corner to keep encouraging you to do the things that you need. After a while, it becomes second nature. So I just want to encourage you that if you have trouble with exercises, knowing what to do, how to do them, how long to do them, what sequence you should do, that's when you need to reach out. If you can reach out and get a coach, get you past that hurdle, you're going to see much more benefits later on in the journey as far as optimal health. So hopefully this has helped. Hopefully it's convinced you that you need to move. You need to move for your health, for your mental well-being, for longevity. You need to move so that, if you do lose weight, you'll be able to keep it off. Because if you don't do these things, I guarantee you're not going to be able to keep them off. You need to be able to do this. And again, one of the main things you can do to help get you there is having somebody in your corner to help guide you the way. Anyway, let's turn to our catechisms. Today, we're talking about the fourth commandment. The fourth commandment, what does it teach us? Is it says to keep the Sabbath holy. Today's Saturday, tomorrow's Sunday. So no matter when you're listening to this, God really puts this in a high order. He puts it in the 10 Commandments. It's not something that is just, haphazardly put into the 10 Commandments. If it was wasn't that important, it wouldn't be there. So if it's there and God says it, we need to obey it. I know for me personally, sometimes I have struggles as far as that is. I want to go do things on Sunday, but good thing I have a good wife who keeps reminding me that, you need to rest. God made your body a certain way and you need to rest. So I keep going back to that. What does God say? We don't need to question it. We just need to obey it. We can wonder why sometimes, and I think sometimes we find out, sometimes we don't. But if he says to do something, this is what we need to do. And he says, keep the Sabbath holy. And the Sabbath for me is on Sunday, so that I need to keep that holy and worship him, not only that day, but the rest of the week. But, rest and recover, because God knows our body better than we know our body, because he made it. Anyway, thank you for showing up. If you guys have questions, concerns, please reach out anytime. I'll be happy to answer any questions that you have. But you guys be fit and be faithful.
This podcast is for informational purposes only. No patient-provider relationship is implied or established. This podcast in no way represents the practice of medicine. The information is own risk. Please consult it, as the contents of this podcast is no substitution for your provider's instruction.